Thank you very much, team. And now we'll turn to commissioners for more or continuing that conversation. So commissioners, questions, thoughts? Go ahead, Commissioner Rogers.
Well, thank you. This stuff gets complex really, really quick. And we've heard, I don't know how many, 2 years, I guess, of the information. And I have a really tough question, but I appreciated the breaking of the bonds. A bit of humor. It always reminded me of a famous line, "Let my people go." Well, I want to break and let our people go. I mean, this is that's probably one of the more graphic, interesting ways of depicting that information. So I appreciate that. This board is made up of a composition of a whole lot of different people, just like your departments are, and we all have different viewpoints on different things. We have different constituencies, and we hear different information. One of the things that I've always followed, and in fact, I know the rest have done this as well, is that we follow the science. And you must have said that, well, all of you, about 10 times in each of your presentations. We follow the science, we follow the science, the best evidence that we have. One of the things that I hear, and it may be different from other commissioners, is what is the science? Because reasonable people have different ideas. And you say, the science is the science. But as much as I'm looking at people, I'm following their advice, and I continue to, there are experts in other parts of this country who have lots of credentials who are arguing that the very science that you're talking about is not accurate. And they're citing all kinds of different studies and so forth. What I have done continually is say, well, I have to follow our experts, not somebody else's. So that's what we do. But having said that, the chorus is getting to be more of a crescendo of folks who are saying, in most professions, including the one I'm in, there isn't lots of different sciences. And I appreciate you can come to a little different conclusion looking at the facts different. But there's lots of different thoughts and lots of different experts, and some with very impressive medical degrees from very prestigious universities and different organizations around the country with different views. So how do you suggest, as somebody who's not with your expertise, answer questions about, well, that's not what everybody else is doing. That's not what's being done in Texas. That's not what's being done in Arizona. That's not what's being done in Florida. That's not being done wherever. And they're willing to take different viewpoints. So how do we answer that?
I'm happy to tee this up from a science communication perspective and then send it right over to our two PhDs here. But in terms of really figuring out what is the science, what does it mean to lead with science, we really have to look at the science community as a whole, not just individual people with credentials. So when we think about what is science, good science leads on peer review. And so when you think about individual papers that you may be looking at, have those papers been reviewed by the scientific community with consensus? Really what we mean by science is community peer reviewed. I think a very similar piece of this is some of your conversations on topics like climate change, for example. You may have a couple of examples of individuals who have different points of view, but if 98% of the scientific community agrees, you can lead with that as being the science. And I'll turn it over to our two PhDs.
I'm happy to start on that one. Thank you for that question. I think that's absolutely something that people across the country are wondering. A couple things. So this is clinical medicine and research are not the same thing. So physicians that are investigating the clinical trials of do these drugs cure the disease is one thing versus scientists that are doing sort of the research at the population level. That's a completely different group of people. And I agree, based on your own confirmation bias, you can find something that agrees with you or disagrees with you 100 times. We know that to be a fact on everything. What I do, because I'm fortunate enough to have the training and education, I go read the peer-reviewed literature myself and make my own decisions. That's what whole committees do for the Centers for Disease Control and Prevention or the World Health Organization. So what I do is I look to those huge overriding bodies with sort of, international level weigh-in from the best scientists in the world. And I look what they come out with and why, because when they state sort of a fact or an opinion about where this pandemic is headed, they have to bring their receipts, so to speak, and they will reference all the literature that you can read for yourself. One of the things to also ask yourself when listening to different individuals speak or organizations speak about the pandemic is who is benefit from it? Are they selling something? Are they part of the pharmaceutical company, et cetera, et cetera? It's important to think about who gets benefit from what they're saying. Personally, with us standing up here today, we don't get any benefit from this pandemic. It's just a lot of really, really, really hard work for all of us. So you can, generally speaking, in my opinion, trust someone who doesn't have a quote unquote dog in the fight, so to speak. So that I also look at that when I'm talking about it. Another good thing to do is the states you mentioned have some of the highest death rates in the country for COVID, like really, really, really high. So check their receipts. These mandates of vaccine versus mask versus social distancing, they do have very measured outcomes on death and hospitalizations. And that's publicly available. Anybody can check that. So you do see different health outcomes based on what each state or, country in some cases are doing. And you can look at that and make your own decision too. But overall, I would look at the number of scientists that contribute to the decision that you're making. I would look if any of them would have any sort of benefit from what they're saying. Are they selling something? And, of course, as Dorian said, everything's got to be peer reviewed. If they're not presenting you with actual peer reviewed literature that supports their opinion, I'd walk away right away. And I don't know, Dr. Bowman Davis, do you have anything else to add on that?
I could, but I think I would be of value. I think you both have done a great job. I think it'd be of value to hear any other comments the commissioners have at this time. Thank you.
I just add thank you. That I'll try to take that and distill it into a succinct answer. Not that yours wasn't good, but as we continue to follow what our experts here are saying, be rest assured that we get bombarded with people who don't share those thoughts. And so it's, I will profess, the other four don't have to admit this, but I profess I like to have great snappy answers back as to why. And so I'm looking at you experts and saying, that makes sense. I like the peer review. I like the idea of who's benefiting. I mean, that's excellent feedback. And I rest assured I'll use it. So thanks.
Thank you, sir.
Okay, who's next? Or are you all set? If you could just give me a thumbs up or a head nod if you're all set. Commissioner Fye, Commissioner Rogers. Okay, I have a couple of things. So you want to put the slides back up. Really tremendous work, team. Thank you very much. On the grounding slide, I don't have a question on it. You can stay right here, slide-wise. But rather, I wanted to thank you, Dorian, for providing that slide, because what you presented there and what you gave voice to really needed to be said. Really. We've learned a lot. Thanks to everyone across our agency, including public health, or especially public health, but it's been a team effort. This agency and our community have fared pretty well compared to others, but darn it, it's still been wicked hard. Wicked. As Dr. Bowman Davis mentioned, she joined as our public health officer during Delta. And I really want to express my sincere thanks to her. All during the month of August, you all know, you've heard, I really threw myself at pursuing any idea that would reduce one more death, prevent one more death, and reduce suffering. And Dr. Bowman Davis met with me while I was a puddle of tears as I had exhausted all those ideas. And I want to thank her for her leadership in pulling together her regional health peers to help me accept in my heart that which I had to accept, that we couldn't reduce that one more death or reduce that suffering just with excellent county practices. It had to be done, not just by county, not just by region, but as a state. And that was so friggin' hard to accept, but it was necessary. And I thank her for her leadership and compassion. Our community, our state, our world has been going through incredible hardship and continues to. There was a slide that was titled the 90-day cycle. And it talked about lowering the disease burden. But I have to say, sure doesn't feel like it. It feels pretty darn depressive that this disease is in control. So my question from seeing that slide, and actually if we could go to it, it's the one that has the variance on the 90-day slides, the 90-day cycle. I'll wait until it's displayed. Sorry, I can't tell you what the number is. There you go. Whoops, that one. Thank you. So what I have failed to understand, and maybe it's too soon, but I would really like to understand, because I have forgotten. You mentioned baseline, and I've totally forgotten what baseline looks like. Because, for example, where we are now, we're still very much in that extreme risk. We're a little less high in the extreme risk. And Mr. Carr, you've been awesome at reminding me of where we stand. And I'm grateful for those gentle reminders. But team, I have forgotten what baseline looks like. Could you remind me of that?
I would say that our new baseline will be when we have cases and it doesn't exacerbate the hospital system or healthcare system. Like that will be, and it's not going to be necessarily year round, as Dr. Bowman Davis said. When we're outside, our cases are going to be lower, right? When we're cramped inside, like flu season, that's when all respiratory diseases thrive. It's going to be worse. And then on top of this, we have 90-day cycles. So ideally, our baseline would be such that, you know, when we might have, maybe we'll have 50 cases a day or 100 cases a day, but it's not enough to threaten our healthcare system. That will be our new baseline. And from going through these cycles, we have a pretty good idea of what our hospital system can handle in terms of COVID caseload. So, you know, at the bottom, these dips at the very bottom aren't destroying our hospital capacity. I'm sorry, Chair Harrington, were you going to say something?
You hit the nail on the head. Bingo. That's what I need to understand.
Okay.
So So it looks like, if I understood you, these troughs
Yes.
really are indicators of that. And the point of the trough does vary from
Yes.
variant to variant. I get that. Wow. So I just have to wait until you guys wave a green yellow flag that says we're in a pretty good state now.
So honestly, if we go 3 months without a wave, I would say we're closer to baseline. Right? If these 90-day cycles either are eliminated, or we hit the low transmission official designation by the CDC, if any of those happen, then that's a sign that we're there. But as long as we still see these huge peaks every 90 days, we're still in it. We've got to wait for those peaks to be done with.
That was a huge help. I
Thank you.
needed that reminder.
Sure thing.
It's like low transmission
Yep.
by the CDC. That was, I can't tell you, from my logical self and my heart self, that is what I needed to hear. I really want to thank Dorian for voicing. Better times are ahead. We will get there. Commissioners, I think that needs to be our consistent theme, especially with our State of the County address. Dr. Rep, I have heard you on numerous and through numerous media reports. You make knowledge so relatable to us being Jane Q Public. And yes, I know I'm a geek, but still, this health stuff, wow, it's a whole different world. And while with all of your help, I have managed to increase my knowledge base over these last 2 years. As Commissioner Rogers says, it's still pretty darn complex. So a genuine thank you for making all of this so relatable. I know our community members and our elected peers really appreciate it.
Thank you, ma'am.
That crystal ball slide tells me that I need to normalize wearing a mask. And yeah, I wear it consistently, but I need to think of it as part of my life. Ahead, it's no big deal. It's just like putting on my shoes or putting on my coat when it's cold. And I mention this because it's part of my life now, just as I saw elsewhere in my global travels during my prior career and prior years, Japan and China pre-COVID. So thank you. I also, at one point where we talked about our workforce, I was reminded from the state economist and economic development data recently that only 1 in 4 Oregon workers can work remotely. So these thoughts about the office of the future and things like that, we need to be very careful. We still have a majority of professions where being on the work site is important. And this is where your support of businesses through these cycles, when you mention that, it's just not about the families and the workers, but also the work environment is so vital. So thank you. To our workforce, I know you're tired. Aren't we all, this COVID fatigue? But one thing I have been trying to stress here in 2022 especially, you need to take a break from all of this intensity. We are doing everything we can to normalize in our work environment, taking vacations, and disconnected ones at that, even for our executive staff. From every single member of our greater than 2,100 workforce at Washington County and another 400 at Clean Water Services, please go on vacation. Just as you were intentional pre-COVID, before COVID, in going on vacations. Now, how you do it, yeah, that'll change. It always has from year to year. But you're human. We care for you. Please take a break from the intensity. Better times are ahead. We will get there. Thank you so much, team. Really valuable information and insight. Thank you for helping us continue to do our very thoughtful work on behalf of our community. Yes, Miss Angie, please take it.
Chair Harrington and board, just as a reminder, we will be taking the clips from Tuesday's work session as well as this discussion, and I will email those clips to each of you in case there's community members or partners you would like to share that with. We will be sharing this information with our city managers, special district managers, as well as our Washington County legislative delegation as well.
All righty. Well, once again, thank you, team. And at this juncture in our meeting, oh, and thank you, Ms. Taniguchi Dennis, for joining us. I know you've been listening in. We're going to take a break for 15 minutes, but when we return, we are going to return to executive session. So we will take a break to 11:20. But before we do that, I need a motion to adjourn to executive session. Okay, Commissioner Treese is waving. Commissioner Treese is waving me down. Yes, ma'am. Oh, was that a motion?
I was making the motion.
Sorry. Motion to adjourn to executive session pursuant to ORS 192.660 sub 2 sub D for the purpose of labor negotiations. And now I've said all the required text. We have a motion from Commissioner Treese. Do we have a second? Second from Commissioner Rogers. All those in favor, please vote by raising your hand or saying aye. Thank you, commissioners. Any opposed? The motion carries 5-0. So at 11:20, we'll be on a different link and we'll see you then.